Hello, it's Dr. Kris. Let's do a quiz. Which quiz are we going to do today? This is going to be fun. You're going to see how I score against other vets on this online quiz to do with CKD. And the real reason I want you to see this is, as a vet, we do something called CE, continuing education, whether it's an online conference, whether we're reading papers, reading books, doing workshops, courses, what have you. And what I want you to see is how, as vets, CKD is presented to us. Because often the way CKD is presented to us forms our treatment plans. But here sometimes lies the problem. Because, as I say, your cat is not a stage. And when we're super focused on staging, sometimes the baby, your cat, gets thrown out with the bathwater. And if we're only approaching your cat through the lens of iris staging, whether they're 1, 2, 3, or 4, sometimes we miss the overall context. And really, that is part and parcel of my book right here. I want you to see specifically why we as vets make certain recommendations to you and how there are alternatives that really matter for your cat. How is it possible for your cat to do better without having to involve everything in the kitchen sink? All right, let's do this together. Let's go through this case report. Let's see how I score at the end of it. Do I make mistakes? Every vet can make mistakes. Let's go through this together. All right, a 12-year-old spayed domestic shorthair cat is presented with polyuria. That means we're peeing too much. Polydipsia, that means the amount of drinking we're doing is elevated. Intermittent appetence. Intermittent inappetence, and occasional vomiting 1 to 2 times per week of 4 months duration. Physical exam reveals the patient has lost 10% of her body weight since examination 1 year prior. Body condition score is reduced. We're at a 3 out of 9, and there's moderate muscle loss. So right there and then, this is very important. This forms the beginning of the bite strategy. This is a common presentation for cats with CKD when they come into the vet clinic because something is going on with them. And strikingly, so many of them have this body condition loss. Now, my guess with this quiz as we go through it is this muscle loss, this body condition loss, maybe it's going to be addressed, but it's probably going to be like a small part of the big picture according to the staging. My message to you is you got to flip that on its head, okay? The muscle loss, the weight loss, the malnutrition that comes along with that, that has to be your primary goal. The other things fall underneath that goal, okay? So let's go through it. Let's see if I'm right or wrong. All right, we go through the physical exam details here. Mucous membrane, so this is on the gums, are pink, moist with normal CRT, capillary refill time, less than 2 seconds. This is just a measure of hydration. If ever you see your vet pull the gums up, touch the gums, let go, we're seeing how much blood rushes back into those gums after we blanch it out. It's a sign of hydration, essentially, in circulation. Heart rate is 180, rest rate is 24 breaths per minute, and rectal temperature is 101. Oh no. Listen, it takes a lot for me to want to take a rectal temperature for a cat. They hate it. I want to be friends with your cat, and I'm only going to do that if I really suspect that fever is part of their situation. Thoracic auscultation is unremarkable. This is when we take our stethoscope on the chest and we are listening for heart and lungs. Both kidneys are subjectively small on abdominal palpation. So the vet's coming in with our hands, we're going in, we're feeling for the kidneys, and lo and behold, they feel too small. And many cats, if they're not overweight, we can actually feel their kidneys, and we make comments on those. Indirect ophthalmoscopy reveals diffuse tortuous retinal vesicules with bulbous retinal detachments. All right, so already we're getting some in the picture here. There's something going on in the retina. I wonder where that could be. Maybe some hypertension? Let's find out. Which can be associated with CKD. Systolic blood pressure is obtained and is 170. What do you guys think of that number? 170. Is that too high? Do some of you have cats at 170 and above? Let's find out. Serum chemistry profile reveals a creatinine of 2.5, which is elevated, a BUN of 33.6, which is elevated, and a phosphate of 6.9, which is definitely elevated. No abnormal findings. So, all right, what's this urea? What's this creatinine? This is uremic toxins within the blood. Right off the bat, just with this in and of itself, we're already leading towards that diagnosis of CKD, chronic kidney disease, right? That's a very reasonable assumption to make at this time, unless proven otherwise. Let's keep on going. We have a reference classification of blood pressure in here, and lo and behold, this little cat tested at 170, and we are defining hypertension between 160 and 179. So that would be true. This cat would be considered potentially hypertensive, especially if the kitty wasn't scared, the stress was pretty good. You know, they don't mention that in the details, so I'm just going to assume it. We don't have white coat syndrome, essentially. When we tested that blood pressure, we weren't too high. As a house call mobile vet, when I go to people's homes to do this sort of thing, sometimes they do test too high in clinic, and I've got to go at home to find out the truth, right? The tiebreaker. All right. Hematological profile is unremarkable except for hematocrit towards the lower end of the reference interval, 27%. Normal is considered between 24 and 25. This is if you're anemic or not. Every lab is a little bit different depending on where you are geographically. These things can change. Urinalysis reveals inactive sediment with a urine-specific gravity of 1014 and a protein creatinine ratio of 1.2. Reference interval 0 to 1.4. Okay, what does all that mean? Urine-specific gravity is a fancy term of saying how concentrated is your pee. When your kidneys are working properly, one of their jobs is to make, especially if you're a cat, is to make a concentrated pee. So when we take a urine sample and the urine is measurably dilute, again, it's telling us something is going on in the function of that kidney. And when we pair it together with what we see in the blood work, which is uremic toxins, which should be filtering out, but they're not getting filtered out, it creates that picture that the kidney isn't doing its job 100% efficiently, right? Next thing, it says urine protein creatinine ratio. Well, in my book, I do describe what that's all about in a way that is really understandable, because you could see already some of these terms, urine protein creatinine ratio, creatinine, creatine, is this what I take to go to the gym? What is this stuff, right? It's a sign of kidney stress essentially, but I want you to know right off the bat, if you're like, it's everything in the kitchen sink coming to me, what do I do? What do I treat? Is it one thing? Is it the other? Is it everything at once? I'm looking at my cat, he's not eating, she is not eating, she's obviously too skinny. Where do I go? You can see quickly, this is proper staging, how it quickly can become overwhelming if this is the approach and everything is to be done at the same time as it is for this kitty cat. My approach is much different. It's based on priorities of what that body needs to show its true health potential, and then you fill in certain blanks and then you watch the cat go, because you're working with that kitty cat. You're working concordantly with them, right? Sometimes they don't want everything at once. All right, let's keep on going here. They did an ultrasound. What did they find in the ultrasound? Yes, they found changes within the kidneys, small, diffusely hyperechoic with loss of corticomedullary definition, suggestive of chronic nephropathy. So even the ultrasound is supporting this diagnosis of CKD. Okay, we got good evidence here. Now let's do the quiz. So what's our staging? So often you're gonna come back and your vet's gonna say your cat is in stage X, stage Y, 1, 2, 3, and 4, and based on these numbers, you could feel pretty awful. Someone can pull, it's like getting the rug pulled from underneath you. Your cat's a stage 3. We all want our cat to have the least stage as possible. There's nothing wrong with that. What I'm saying is, stage isn't everything, and stage can be plastic. It's a measurement, it's a snapshot in time in the blood work. Right? So let's now go through this quiz. We have this stage here. Our stage is stage 2, CKD. Substage, hypertensive proteinuria is diagnosed. What do we do? Where do we go? Let's look at, as a vet, how we're educated, what to do with this kitty cat, and I'm gonna interject when I agree, when I don't. Hopefully I get these answers right. All right, quiz. First thing, which of the following drugs would be appropriate for this patient? Telsimartin. This is also known as Sementra. What is Sementra? Well, it helps with this thing in the staging called protein creatinine ratio. What is that? It's a sign of kidney stress. What else does this drug do? It can help lower blood pressure a little bit. So we already have 2 indications in this workup for this cat where it could be a good idea. So I'm gonna select safe. It's safe to use for this cat. Let's hit it. Boom, I got it right. All right, correct. This is a receptor blocker, effective treatment of hypertension in cats, can decrease blood pressure, and it's going to tell me it can also be used for proteinuria. Where does it say it? A lower dose is used for anti-proteinuric therapy, and it's been shown to decrease the magnitude of proteinuria in cats. All right, so we get that first one right now. Am I gonna jump on this with every cat? Well, maybe not. Why? This is the first thing that's come to my attention as a vet. Treat the proteinuria, treat the blood pressure. Those are important things, but something else has to also be going on just as importantly for your cat, and it wasn't described to me first of all. What am I talking about? The body weight, the body condition, the appetite, the vomiting. Maybe it's gonna come later. It's probably gonna come later, but this is the first thing that's programmed in our minds, right? Here's the problem, treat the chemistry, treat what's going on. But what if your cat is picky? What if your cat doesn't like this drug? Oh my God, are you out of options? Absolutely not. Absolutely not. That part of this sub-staging may not have true relevance of how well your cat can do, right? You gotta look at the whole picture. Let's keep on going on. Next, benazepril. Which of the following drug is appropriate for this patient? Benazepril. What is benazepril? It's kind of like an older school drug. We used it for, again, kidney stress, proteinuria. You got to be careful with it. It can lower blood pressure. Some vets would use it together in combination. It's still used like that. What are we going to do? Do not use? No, it's not that. Safe. Well, and proceed with caution. It's either going to be safe or proceed with caution. I'm going to say if we're already using the first option that this quiz liked, which was the telsamartin to lower blood pressure, am I gonna add this on at the same time? Maybe I'm gonna think about it, but I'm gonna proceed with caution. Let's hit it. Well, boom, there I go. I didn't embarrass myself. There it is. All right, correct. This ACE inhibitor is efficacious as an anti-proteinuric agent in cats. This is to help for kidney stress, but it's not recommended as a first-line agent for hypertension in cats due to clinical insufficient decrease in blood pressure, right? I guess when used by itself, because it is described to be used in combination with other things. And if I live somewhere, and this was the only option that I had, well, I'm gonna tell you, oh, I guess this is all right, proceed with caution. I will proceed with caution and I will use it, right? So these things aren't written in stone, right? So this is something that can be used for your cat. But again, is this sort of thing the first thing I'm describing with the newly diagnosed cat with CKD? Well, if I was only thinking stage, yeah, some vets I could see, you're just getting a lot of this information thrown at you and it's gonna feel overwhelming, especially if your cat doesn't like these things and they're rejecting it and you're gonna be like, oh my God, I'm failing my cat. Again, my emphasis using the BITE strategy, which is body weight and intestinal health for toxin elimination, will really get to the core of what CKD is and how you can start to slow it down on your cat based on the physiology of the pathology of what CKD is, right? These are bits and pieces that matter, but again, am I seeing an overall plan here? Am I getting recommendations based on piecemeal problems with my cats? That's what this is so far, according to my opinion. Next, amlodipine. All right, so would this be appropriate for this patient? Remember how they showed the retinas for this little kitty cat here, and they described these tortuous vessels? So essentially, this is hypertension is stressful for the fine little itty bitty parts within the kidney, retinas, central nervous system, and it can cause damage slowly over time. This cat was only at about 170 in terms of blood pressure, not super high, but we're hypertensive and we're already seeing changes. So it is important to catch hypertension, and it is important to treat hypertension, and it is also important to get your cat eating and out of malnutrition, sometimes even before you deal with hypertension, because that's how they show you that they can do better and maybe even tolerate medications better. Again, how these things are arranged and not everything all at once really matters. So for this one, should it be do not use? I don't think so. Proceed with caution. It's actually a pretty safe drug. I've never seen side effects to it other than if they preferred a capsule versus liquid in the form of the medication. Cats have preferences, right? And is it safe? I'm gonna say safe. Okay, I gotta hit down here. Boom, all right, correct. Amlodipine can lower blood pressure between 28 and 55. If that worked for this kitty cat, then it would lower it and we would get back into normal range. I describe how to do that in this book, and the dosages that I use and when I do it, when I don't do it, right? So next thing, let's go to the next one. Hydralazine. Well, I don't even know what that is. I've never heard of hydralazine before. And I know my cats. So I'm just gonna say, trick question. It's probably not safe. It's probably proceed with caution, but I'm just not gonna use it. If I don't know what it is, why am I gonna use it? Okay, do not use. All right, correct, let's see what it is. Hydralazine is a direct arterial vasodilator and should not be considered first-line therapy for hypertension in cats. Although this drug has been used in the management of acute hypertensive emergencies in both dogs and cats, well, that's probably why I haven't heard of it. You know, it's been a long time since I was doing a after-hour emergency care. That's from me and Dr. Kris in his youth, right? Now I focus on medicine, chronic cases, that sort of thing. Hypertensive emergencies are encountered infrequently, all right, it's not just me, infrequently, and are typically defined as blood pressure above 180 with signs of intracranial target organ damages, seizures, altered mentation. All right, so really not relevant for CKD. Glad we got that one right. All right, let's keep on going. Darbepoetin alpha. All right, what is that? If you're anemic, then CKD can cause anemia. Let me just start there, right? So the kidney is responsible for making a hormone called EPO. EPO goes to the bone marrow and it says, hello, I need some more red blood cells. But with CKD, through a number of different mechanisms, there's not enough EPO being produced. And so the bone marrow is falling asleep. It's on the job. We're not making enough red blood cells. So that is the definition of anemia. And that's actually so sneaky for your cat. And again, it's this thing I'm calling the bite strategy. Even before I'm going through staging, I'm looking at, even if your cat wasn't anemic, how do I reduce their chances that they become anemic? And this really comes down to avoiding malnutrition, proper body weight, and then in the bite strategy, there's certain intestinal health for toxin elimination. There's certain supplements we're using in there to try to avoid this or even to treat early anemia. And when you have a simple plan like that, that's actually just kind of taking care of things for you behind the scenes, even without knowing these details, it's a big win. It's a big win for your cat. So what about this Darbo? Or some people won't have access to this. This is essentially a hormone. So Darbo, or there's another one called Eprex, these are stimulating agents, right? They're there to stimulate that bone marrow to produce the red blood cells if your body isn't having enough EPO. Now here's the good news. Sometimes when you stimulate the body, it kind of wakes up a bit, especially when you followed a strategy like the bite strategy and you've set that body up for strength, for resilience, so it can respond. It has the energy, the ATP, the proper mitochondrial functioning to wake things up, light that spark, and get your cat moving. So do we need Darbo in this cat? Well, if I remember properly, they said, let's look for it. What we're looking for is either hematocrit or PCV. We're looking to see how anemic we are. Do I see how anemic we are? Let's go down here. Here we go, 27%. 27% for me, 27% for me is not in the territory where I'm using this agent. I'm using iron, I'm using the bite strategy, I'm using vitamin B12 to get this kitty cat to reestablish stability with red blood cells. So I'm gonna say, you know, could I use it? Is it safe to use in this kitty? Well, there's side effects to these things, so I wouldn't say it's safe at this stage. Proceed with caution, maybe, if I was really worried about this anemia, but would I say do not use in this case? I'm not gonna use it in this case. All right. it agreed with me, and it says consider treatment with this stimulating agent called Darbo in cats with CKD when they're less than 20%. Some of us aren't going to wait that long for less than 20%. Some of us are, and so that's when you're going to use it. All right, let's keep on moving. Meloxicam, otherwise known as Metacam. Wow. That's great they put this in here. Very controversial. And so when it comes to meloxicam, what's even the point? What's an anti-inflammatory? It's a pain medication. It's very common. It's on label for cats. However, if it's misused in dehydrated cats at a very high stage, it can be a problem. And what do I mean by misuse? Well, again, I talk about it all in my book of if you need to use it because your cat's older with arthritis and nothing else is working, or he's got neurological issues and maybe you don't want other treatment plans that could irritate or bother that situation, there are some cats where it's still applicable for. It's a nuanced conversation, but oh my goodness, I'm not following the label directions on the box, especially if you live in the US. I don't know what's up with that, but the label instructions on there is too high in my opinion. I don't use it that way here in Canada. So, and I think it's different in Australia too. So, should we use this? Well, if I had strong, if it was for a quality of life reason, I didn't have reasonable alternatives, and there are some alternatives, but what if I had to? What if I had to make a call? Is it a strict do not use, like binary, it's one or the other? No, it's always somewhere in the middle. It's not binary. So let's figure it out. I'm gonna say proceed with caution. As you would always do with a medication like this, you're always going to proceed with caution. Let's go for it. Shabooms, all right, correct. CKD prevalence in cats. CKD prevalence increases with age in some cats, and some studies reporting prevalence of 50% in senior cats. I would agree with that. Cats are therefore likely to have comorbid conditions. This simply means they have more things going on than in one. And that is a chapter in this book where I'm describing how many other different things that can be affecting in their body and how you would put the whole picture together. How CKD affects those things and how those things affect CKD, the relationships between, how to simply put this plan together, right? And so they're right there by saying that. Okay, this has historically led to an avoidance of NSAID therapy, that stands for non-steroidal anti-inflammatories, or non-steroidal anti-inflammatory drugs therapy in cats with CKD. However, meloxicam tapered to the lowest effective dose has not demonstrated an effect in the creatinine or lifespan of cats with stable CKD. All right, key words here. Titered to the individual, titered to your cat. You cannot use any of these medications in a one size fits all. One size fits all is you just read the label as a vet on the box and you just draw the medication up to your cat's body weight and then you just wash your hands of it. There we go. No. That's one size fits all. You've got to do it in a very nuanced way. And therefore, in my hands, to date, knock on wood, I haven't had problems, okay? This drug may increase the magnitude of proteinuria and should not be administered to patients that are dehydrated or hypovolemic. Well, yeah, that's true. If they're dehydrated, which is hypovolemia, you don't want to have this on board. Therefore, caution is needed when using this medication in cats with stable CKD. I would say caution is needed with any medication for cats with CKD. It's always going to be a nuanced conversation. All right, let's go to the next one. How many more do we got here? So far, I got 6 out of 10. Mirtazapine. All right. Which of the following drugs would be appropriate for mirtazapine? One of the key features of trying to get your cat better with CKD, whether he or she has been newly diagnosed or whether it's a journey and you're several years into it and then something changes and your cat ends up skinnier or isn't eating as much or is eating but we're still getting skinny. Something else is going on with our efficiency of absorbing this food. In any of these scenarios, essentially what's going on is your cat has some subclinical malnutrition. This is very damaging to the kidney. This is one of the things that can end up with fibrosis. Fibrosis is the key. I talk about that in the book and I talk about that in my video course designed to help you go through and get the best results for CKD treatment for your cat. Fibrosis is the key. And when you target your therapies with your treatments for cats, much of which you can do at home, around the idea of not necessarily staging, but the core issue of what's going on called fibrosis, good things can happen. You can truly reveal your cat's health potential. So let's bring it down to mirtazapine. Mirtazapine, in my book, it's in the first chapters. Why is that true? Technically, your vet might just say it's an appetite stimulant. I don't want you to think about it that way. It's so much further, it's so much more important than that. Yes, it can stimulate appetite, which can get in calories, which is important, which can help build body mass. But secondarily, it also can reduce nausea and vomiting, which is a big problem for this cat because they said 1 or 2 times per week. That's not helping. The next important thing is that your cat's kidneys are stressed because you're malnourished. There's not enough protein coming in. There's probably not enough blood flow going to that kidney. And if we're anemic, we're hypoxic at the same time. There's not enough oxygen getting there. Not having enough calories enter your cat's body just makes that whole cycle work. And I've got a video that talks about why that's true and how the mitochondria, which is the little workhorse inside of your cat's kidneys, need that support. If they don't have proper energy, proper ATP, how can your cat get better? Notice this discussion has nothing to do with proteinuria, has nothing to do, which was one of the first things that was identified. They're kind of related. In staging, we kind of talked about blood pressure. We talked about proteinuria first. I'm never talking about those things first. They're totally relevant, but I've got to set the stage for success for your cats. We've got to build the foundation, right? Mirtazapine. I use the gel. It's an ear gel. You rub it right in the ear, just like so. It's fantastic. It works well because I like to spare the oral cavity for food and other essential things I got to get in there. So I'm trying to not get everything through the mouth, right? It does come in little capsules and little tablets as well. Is it safe? Yes, this is essential. And the quiz agrees. It says inappetence, weight loss, and vomiting are common clinical signs of CKD. In addition to the negative effects on quality of life, low body weight is associated with shorter survival times in cats with CKD. Why is that true? Because it causes more fibrosis. It is pro-fibrotic, and that's why the kidneys advance. Imagine if that ear gel or this medication, mirtazapine, was framed to you that way, that it is something that can help increase your cat's lifespan because of its effect eventually by proxy on the kidney. But we don't talk about it that way. Targeting these signs is important for management. Mirtazapine has antiemetic. This means it can reduce vomiting. It's great that they put that in there. Mediated through the 5-HT3 receptor. In cats with CKD, mirtazapine can increase appetite and activity, decrease vomiting, result in weight gain when compared to placebo. All that's true. Administration of every 48 hours rather than every 24 is recommended due to the increased half-life of mirtazapine in cats with CKD. I'm gonna say this is it's never one size fits all. Some cats, I want them eating and gaining weight as quickly as possible. So I'm using it every single day in the beginning until otherwise directed. Now I'm using the ear gel, so I tend to see less side effects because it tends to be absorbed more gently, slower, more diffuse, versus the capsules or versus the tablet sort of thing. Other cats, every other day is sufficient. I've had some cats every 3rd day over many years, right? It's just this baseline level of support. So this is definitely a good idea here, but I don't want you to think that it has to be every other day. It's a cat by cat decision. All right, gentamicin. Did I do that right? Yeah, mirtazapine. Let's go to the next. Gentamicin. This is funny because this is just one of the things you remember from vet school. And vet school for me was a very long time ago. Nephrotoxic. It's one of the first things you learn about this drug. It's nephrotoxic. You don't want to use it. It's an antibiotic. You want to move on and do something else. Safe? Nope. Proceed with caution? Nope. Do not use. Yes, it's one of these things you learn in vet school. Another thing that we learn in vet school is white feet don't treat. And so if for dogs with white paws, they tend to be, they're collies and stuff, and there's certain drugs, ivermectins and stuff you can't use with them. There's certain analogies that they give us. So gentamicin and kidneys is one of those. I just recall that from over 20 years ago. All right, I'm gonna say do not use. Correct, do not use. They can be, so cats with CKD are frequently giving antibiotics due to the association of kidney disease and the development of upper urinary tract infections. Gentamicin is an aminoglycoside antibiotic that is eliminated via renal excretion without undergoing metabolism. A small percentage of cats is retained in the proximal tubular epithelium following glomerular filtration, resulting in nephrotoxic effects. See, I kind of forgot the physiology behind that, but that's okay. Because I knew gentamicin, don't use it. Don't use it in CKD cats. All right, next. Maripatent. This is the name for either Serenia or Emavert. These are anti-nausea drugs. They have other effects in the body as well in terms of inflammation, congestion in some cats, maybe some pain control in some cats. Is it, this cat's vomiting, can I use it? I can use it. Is it safe? Yes, it is. Rare for me to see side effects for this stuff, whether I use an injectable or the little, you take a 16 milligram tab and you quarter it and you give it like every day, every other day, every third day, depends on your cat. Proceed with caution. I don't need to proceed with caution. Do not use, we're safe to use this one. All right, correct. This is a neurokinin 1 antagonist with antiemetic, so anti-vomiting and anti-nausea effects that has been shown to be effective for vomiting associated with CKD. You can use this in conjunction with mirtazapine, right? So this is a good one. Now, why is this important? Sometimes when you get rid of nausea, your cat is going to eat more. They keep more of that food in their body, and like I'm saying, body weight and increasing body weight and stability of body weight is associated with higher survivability, slowing down fibrosis within the kidney. You want that. All right, let's keep on going. Okay, so far I got 9 out of 10. What is this? Aluminum hydroxide. Which of the following drugs would be appropriate for this patient? If you recall, for this kitty cat, they said the phosphate is 6.9. What is, and it's higher than normal. What is phosphate? Why is that important? Why do you need to know about that? Notice how this was last in this quiz, but in my book over here, it's one of the first things you're going to read about. This is one of those where the rubber meets the road. If you want to truly show if your cat is diagnosed with CKD and there's a certain stage, you want to see if your cat can actually do better than what the stage says. And for some cats, they can even go down a stage, right? Because your cat's not a stage. So what is this aluminum hydroxide? I describe it as phosphine in the book, and it's the common one. And what is it? Phosphate in the body, your cat's gonna absorb it through food. It's normal in food. They're carnivores, right? And phosphate is chemically linked to protein. So they're gonna absorb that into the body, and then it's supposed to be filtered out by your kidneys. It ends up too high. When it's too high, it's a waste product in the body. But when the kidneys are tired, when they have CKD, it goes higher and higher and higher in the bloodstream. And that's some bad news because at that point in time, it's considered a uremic toxin, and high phosphate over time that's not addressed eventually causes kidney scarring. Fibrosis means scarring. And when that kidney scars up, it doesn't want to come back, right? So dropping that fibrosis through dropping phosphate, and there's multiple reasons to drop phosphate, but this is a good idea. This is one of the strong justifications of a prescription renal diet. They can be quite good at having lower phosphorus and yet delivering an appropriate level of protein often. Not all the times though. Not all of the time though. So often I meet a cat's not interested in having a prescription diet, or they're partially on a prescription diet, and I still need to drop phosphorus that's located in the food. What this medication does, it's actually not even a medication. It's more, I think of it more of like a food additive. It's a powder, you mix it into the food, and it keeps some of that phosphorus in the gut, and then your cat poops it out instead of being absorbed into the body. Win-win when used at proper doses. So do not use, nope, proceed with caution. I don't have to proceed with caution with this one. I would proceed with, what's the caution here? The caution is not using it, not considering it. Is it safe? Yeah, it's safe. All right, correct. In cats with CKD, phosphate accumulation occurs as a manifestation of the impaired excretory ability of diseased kidneys and commonly results in hyperphosphatemia. This is too much phosphorus in the blood. Elevated serum phosphorus is associated with progression of kidney disease. Yeah, because it scars it up. Reducing serum phosphorus is therefore an important component of treatment. Dietary phosphate restriction is available via commercial available diets. An enteric phosphate binder is indicated when plasma phosphate remains above the iris target range. All right, so with this, you're gonna mix and match these things. You're gonna recheck the blood, you're gonna see where the phosphate is, and you're gonna go from there. So this is a very important thing. I think we're done the quiz. All right, I did good. So we did good. Okay, what do I got here? 10 out of 10 questions, 100%, look at me. I mean, that certainly wasn't true in high school, let me tell you. Definitely not getting 100% anything in high school. Participants to date, 5,223, high score, 100%, average score, 63%. All right. Well, yeah, I could see that. There were some tricky questions in here. And at the end of the day, though, you look at this case, right? And for this little kitty cat, and if I walked up to you and I said, your cat is iris stage 2 with proteinuria and hypertension, we need to start prescription diet, we need to start Serenia, mirtazapine, we need to, if your cat's arthritic, we should maybe need to consider some meloxicam, and then in addition to that, we got to consider telmisartan, and then, or maybe it's amlodipine, but certainly with this high protein creatinine ratio, we have to balance all this. Am I overwhelming you? Is it too much? Are you looking at your cat and your cat's looking at you and saying, I just need to feel better, I'm puking, I'm skinny, please help me? This is when you've got to know how to put all the pieces together. This is when you need the confidence to know when to start something and when to put something on the back burner. And that really, it's hard for you to know that if you're coming at this the first time without, a couple decades of experience and thousands of cats with CKD under your belt, right? And so I want to give you that experience so when you get these recommendations, you can confidently say, this is what's important, this is what's next important, and this could be on the back burner until this point in time, until I've established these other things for my cat over here. This is the emphasis of this book, and that is the emphasis of my CKD Master Guide. You can see how, as vets, we're trained to think about CKD. You can see how it's accurate, it's going to help your cat, but you can also see how it can be overwhelming, and why I say that your cat is not a stage. We need to think about them differently. Hope this was fun, hope that helped. Till next time.